Welcome to the fascinating world of health psychology, where we delve into definitions, models, history, ethics, and regional applications. This field bridges the gap between mind and body, promoting health and preventing illness. Health psychology examines the interplay between mind and body to promote health and prevent illness. It serves as a bridge between clinical psychology, behavioral medicine, and public health, focusing on both individual and systemic levels. This broad, interdisciplinary field involves research, clinical practice, consultancy, and advocacy. Collaboration with medical, public health, and community stakeholders is essential to address complex health issues. Health psychology plays a crucial role in health promotion and disease prevention through interventions like smoking cessation, diet, and physical activity. It also addresses chronic illness and disability, focusing on adjustment, quality of life, and psychosocial needs. Effective patient-provider communication and healthcare behavior are vital, involving shared decision-making and health literacy. Stress, coping, and resilience are explored through psychological and physiological pathways, impacting health equity. The goals of health psychology include improving health outcomes through evidence-based interventions, enhancing quality of life, reducing health disparities, and supporting culturally sensitive care. In regions like Zambia and Southern Africa, health psychology plays a role in HIV, AIDS prevention, mental health stigma reduction, and community wellness programs, emphasizing contextually appropriate interventions. Health psychology adopts a holistic view, considering psychological well-being and social conditions as crucial as biology, aligning with WHO's perspective on health as a dynamic balance of body, mind, and society. The biopsychosocial model, proposed by George Engel, represents a paradigmatic shift, understanding illness as an interaction of biological, psychological, and social factors. This model integrates biological aspects like genetics and immune function, psychological elements such as emotions and behavior, and social factors including culture and community networks. The model encourages holistic assessment and multi-level interventions, integrating molecular, individual, and societal perspectives in care and research. Health psychology combines psychology, medicine, and public health theories, applying methods like CBT-informed interventions and community-based participatory research. In African settings, health psychology incorporates indigenous healing practices and community networks, exemplified by HIV and maternal health programs using local structures. The origins of health psychology trace back to the 1970s, recognizing the limits of the biomedical model, leading to the establishment of APA Division 38 in 1978. From the 1980s to the present, health psychology has focused on chronic illness, stress, and health behavior change, expanding into global and digital health, emphasizing equity and social determinants. Key contributors include George Engel with the biopsychosocial model, Shelley Taylor on stress and coping, and Marie Jahoda on positive mental health, shaping the field's development. Southern African scholars adapt foundational theories to regional challenges like HIV and trauma, highlighting the importance of contextualization in health psychology. Students are expected to critically engage with theory and research, apply principles to real-world contexts, reflect on cultural relevance, and demonstrate professionalism and collaboration. Assessments include quizzes, case analyses, and reflective journals, culminating in a final exam or portfolio, ensuring cultural sensitivity and alignment with local health priorities. Core ethical principles include informed consent, cultural sensitivity, non-maleficence, and advocacy for vulnerable groups, guiding applied work in health psychology. Understanding ethics in regional contexts involves navigating traditional healing systems, resource constraints, and community dynamics with humility and cultural competence. In research within resource-limited settings, it's crucial to avoid exploitation, ensure benefit sharing, and respect communal decision-making norms. In Zambia and Southern Africa, addressing HIV, AIDS prevention and care requires behavior change, art adherence, and stigma reduction through community-led and culturally sensitive approaches. Maternal and child health benefits from psychoeducation on antenatal care, breastfeeding, and responsive parenting. Reducing mental health stigma involves public education and community-based psychosocial support. For trauma and resilience, integrating cultural rituals, peer support, and evidence-based therapies is essential for populations affected by conflict and bereavement. Strengthening health systems in Zambia and Southern Africa involves training healthcare workers in communication, brief psychological interventions, and task shifting to non-specialists, enhancing overall healthcare delivery. Successful implementation hinges on collaboration with local stakeholders and community leaders, sensitivity to resource limitations and cultural norms, and investing in ongoing monitoring and evaluation for sustainability and effectiveness. In summary, health psychology is holistic, interdisciplinary, and practice-oriented. The biopsychosocial model underpins integrative care, with ethics and cultural competence being central, especially in Southern African contexts. Applied health psychology can strengthen public health outcomes when grounded in local realities.